Hello and welcome back to the History Channel. Today we explore the beginnings of surgery. Have you ever wondered who first had the courage to cut into another human being? Who are the founders of surgery? How far back do we have to travel to find the origins of this life-saving practice? It turns out it's quite the journey. First we will start in Mesopotamia, where we will consult with our ancient world specialist Abigail Mitchell. We see evidence of surgery very early on in human history, in the time of Mesopotamia, when King Hammurabi ruled Babylon. The Hammurabi Code of Laws, created in 1754 BC, had laws pertaining to surgery, although surgery itself wasn't a noteworthy craft. As we travel along through history, the next noteworthy time period was during Egypt. Egyptians were performing mummification in classical antiquity around 300 BC. As a result of the mummification, Egyptians knew of the pieces of the body that we're looking for, but not of their function or how they fused together with other parts of the body. Egyptians developed skills for setting bones and knowledge pertaining how the sockets work and how to set limbs back into sockets. This is mostly a result of the injuries obtained as from members of their huge military. Cutting surgery was very limited and would be at a level of current-day first aid, with not much cutting and more stitching up wounds and bandaging. The way that people have learned about surgery was through dissections, but that was frowned upon because of the ancestral worship forbade the mutilation of the body of a dead person. This limited their anatomy knowledge to a primitive knowledge. Contradictory to the overall view of surgery during Egyptian civilization, there have been findings in tombs of an elective surgery. The surgery depicted was circumcision. This was performed by assistants to priests, priests and the royal family. A crude stone instrument was used. This procedure was not widely known, as it was only a religious ceremony for nobility. As we travel through time to Grecian world, we don't see much in the advancement of surgery, as the Hippocratic law prevents surgeries. Surgery is only used to treat war injuries. As a result, the physicians who work with the armies are the ones with some knowledge of the body parts, but is largely known about the surface more than the internal anatomy. Bloodletting was a new technique that came about during this time. As a way to reduce fevers, and again with the treatment of minor wounds, fractures and dislocations are common and described in Hippocratic writings. We sit at the end of the Grecian period as Romans conquered Greece in 146 BC. Greeks settled in Rome and are ruled by Romans, but not trusted by them. As a result, there is a stagnation in the advancement of surgical discoveries. Romans did hire Greeks as wound surgeons, however, for the armies despite this mistrust. Galen, the Roman hero at his time, being the best medical research of antiquity, had claimed to have done surgeries. Lots of surgeries, and more than others had believed. He does do dissections on animals, making assumptions about the human body from these findings. From the dissections, he proves the brain is key and is connected to the spinal cord. He also makes the discovery that the bladder produces urine. Ultimately, Galen's better physiological understanding allows those who follow able to make the surgical advancements. He did not have a specific surgical textbook, but small writings on surgeries are scattered throughout his other books. These books contain descriptions of varicose veins, repair of cleft lip, removal of polyps from the nose, and the suturing of intestines after penetrating injuries of the abdomen. Bloodletting is more specific, as information regarding the amount of blood that should be removed is provided. The vast majority of these discoveries came from the treatment of gladiators and soldiers. Owners had a lot riding on their slaves and the ability to fight, so they would pay to put the gladiators through all kinds of surgeries. Galen was thought to have been the first to suture tendons, and muscles were commonly sutured. Galen was reluctant to use surgery, as success was rare in surgery and failure was frequent. His failure did not necessarily come from poorly thought out procedures, but due to the lack of anesthesia, antibiotics, and inadequate pre- and post-operative care. The overarching theme from all these periods is that surgery is still the last resort, as chances of surviving surgery in the ancient world are very low. Wow, thank you, Abigail. That was riveting. As we transition to our next noteworthy time period of surgical innovation, we turn to our expert in the Middle Ages, Lucas Coxhead.
Thank you for that lovely introduction, Abigail. After the Greco-Roman period, civilization went through a time of medical decline. The level of learning was far inferior to the Greco-Roman period, with very few new innovations. During this time, Arabs preferred the hot red irons, or cauteries, to the surgical knife. They used cauterization as their main surgical tool, and it was used to treat many different illnesses. It was mainly used as a counter-irritant. By producing irritation in one part of the body, it relieved pain in the other. Also used as a homeostat, treating bleeding vessels to prevent hemorrhaging. Additionally, it was used as a bloodless knife to destroy tumors, to treat infections, diseases, trauma, epilepsy, ulcers, and cancer. The idea of cauterization spread considerably from the Arabian world into Western Europe after the 12th century. In Europe, surgery was generally not allowed under the rule of the church. Basic surgery was therefore delegated to barbers. Barbers performed bleeding, cauterization, and tooth drawing. Roger de Salerno was the first to write about brain surgery in 1170. Salerno had an unusual technique of checking for leakage of cerebrospinal fluid in a patient with a skull fracture. While the patient held his breath, he would observe for a fluid leak or air bubbles in the back of the neck. While most surgeons looked at pus around an incision as a sign of healing, Theodoric of Serbia was one of the first surgeons to avoid this pus. He attempted to discover the ideal conditions for good wound healing. He concluded that this consisted of control of the bleeding, removal of contaminated material, avoidance of dead space, and very careful application of a wound dressing that had previously been bathed in wine. This is still considered to be one of the best revelations in the time of medieval surgery. In the 1200s, William Salicito was the first European surgeon to switch from using the Arabic method of cauterization to using an actual surgical knife.
Wow, he really knows his stuff. Now we're going to go and consult with Pierre Leblanc in his area of expertise of the Renaissance.
Merci, Mademoiselle Abigail. The European Renaissance from the 14th to 17th century is known as the Second Surgical Renaissance due to many advances made in surgical techniques and instruments. At this point, each European country began to develop its own recognizable practice of surgery, and most surgeons were artisans joined by guilds. In Germany, most surgeons had no traditional formal education because they could not read or write Latin. Instead, they were apprenticed barber surgeons who were well versed in the surgery of war. A German doctor, George Bartisch, is known as the founder of modern ophthalmology. He was credited as the first surgeon to practice the extirpation of the globe in cancer of the eye. In Italy, Giovanni de Vigo wrote Practica in Art Surgica Capiosa Continens Novem Libros, which was the most detailed portrait of European surgery during the end of the 15th century. Gaspare Tagliacozzi was another surgeon who was a founder of plastic surgery. In a work, he described the operative methods for treating mutilating injuries and nose defects. In mid-16th century France, Ambrose Paré emerged from the ranks of barber surgeons. He contributed to surgical amputation and design of limb and ocular prosthetics, and he reintroduced the ligature of arteries, which was the practice of tying large arteries. This replaced the medieval method of searing arteries with hot irons. Paré also discovered the perceived sensation of the phantom limb and invented an ointment made of egg yolk, rose oil, and turpentine that can be used on injuries instead of boiling oil. At this point in time, there was a vigorous rivalry entre internal barber surgeons et surgical peers. In France, there was a controversy among the French barber surgeons who became surgeons of short gowns, while the long gowns were academic surgeons of the Collège de Sainte-Combe. However, the barber surgeon guild grew much quicker, and the public recognized them as having superior skills. Ambrose Paré helped bring about the union of Barbel-Surgeons and Saint-Côme-Surgeons. Jean Canapé, a French doctor in the mid-16th century, translated Guy de Chauliac's work from Latin to French so that the Barbel-Surgeons could access surgical teaching. On the other side of the channel, the Parliament in England passed a statute in 1540 uniting the Company of Barbel-Surgeons with the Guild of Military Surgeons. The new royal commonalty of Barbel-Surgeons received many more powers that removed them from performing barber tasks and improved their education. You could receive a grand diplôme as master in surgery in anatomy. The craft of surgery had a respected position by the end of the 16th century. The Renaissance provided surgeons with their first substantive opportunities to become respected members of the healing professions. The scientific revolution in the 1600s was a turning point in the history of surgery. William Harvey discovered how blood circulates through the body in 1628, which was vital information in the understanding of surgery. In 1626, the book To Barbier was written specifically for barber surgeons. However, surgery did not advance as much as anatomy and physiology during the 17th century. In 1629, a new charter in England was passed which mandated that no one could practice surgery unless they passed an exam in the presence of 2 or more barber surgeons. By the mid-1600s, it was evident that English surgeons were reaching a position of equality with even the most outstanding physicians. By the 1690s, most surgeons were performing minor surgeries and only 5% practiced new procedures like lithotomy and ocular surgeries. Merci beaucoup pour ton temps.
Thank you, Monsieur. Our expert on the 18th century, Dr. Kenneth Brown, unfortunately is unable to talk to us today. He left the contact of his student, Sabrina Simpson, to share with us his studies on this time period. Please welcome her. Hi guys, I'm super stoked to talk to you about the 18th century today. Join me. I am getting bonus for helping out Dr. Brown, but I'm still really invested in this time period of surgical innovations. So, by the 1700s, physicians had already a lot of knowledge about anatomy, but also bone setting and minor surgical procedures. But at this period, they became more badass. They were willing to attempt more surgeries without anesthesia. And they most frequently performed surgeries of amputations, as well as procedures as removing bladder stones, cancers, and cataracts from the eye. Thank God, because it's really ugly, creepy seeing someone with a cataract in my eye. It's not really good. So, the historical list of surgical advancements in the 18th century progressed as surgeons in England and Europe developed new techniques to control bleeding, drain and close surgical wounds, or repair wounds that resulted from military combat, especially those from explosive and gunshot wounds. Oh, wow. Surgeons also increased their abilities to repair malfunctions in the urinary system and the intestinal tract. They performed cesarean sections, they amputated limbs, and removed gallstones. They did radical surgeries to remove cancerous tissues, they removed glands and organs such as the thyroid and the spleen, and they developed antiseptics. In 1718, there was a French surgeon, Jean-Louis Petit, 1674 from 1750s when he lived, and he developed a tourniquet to stop bleeding during an amputation. Petit's tourniquet worked by twisting a screw compressor device that clamped down on the patient's leg. Oh, that sounds like it hurts. And on the lower abdomen that could stop the blood flow in the main artery and provide for higher leg amputations. I don't know why you would want your leg amputated further up, but okay. Petit's tourniquet is considered by many sources to be one of the most important surgical advancements before anesthesia. So, surgery was improved in this time by improving conditions where the patients were kept and by providing clean beds and fresh air. No duh, God. Thereby improving chances of survival. Also, surgery started to take place in separate rooms from where other patients were staying. God. In England in the 1700s, surgeons and barbers were in the same guild. In the mid-1700s, the surgeons desired to be separate from the barbers, and the bill was passed in 1745. I understand. What are barbers? Why do barbers come into play here? Do they give haircuts in the hospitals? Thank you, Sabrina, for your interesting presentation on surgery in the 18th century. Now I would like to turn to our specialist from the 19th century, Dr. Charles Ennis.
Thank you, Abigail, for the lovely introduction. The 19th century brought a host of new developments in the field of surgery, especially in the United States. The discoveries included the development of antiseptic and aseptic surgery, radically new operative procedures, the use of X-ray, and the evolution of blood transfusion, and the development of the field of obstetrics. Wilhelm Röntgen first used X-rays in 1895 to locate and diagnose fractures. Another important advancement was the more comprehensive education for surgeons. The Act of 1815 clearly defined the educational requirements for the Royal College of Surgeons. By December in 1844, Horace Wells discovered that ether and nitrous oxide can be used as an inhalation anesthesia, and the development of surgical anesthesia advanced rapidly from there. Post-operative infection was also resolved without a clear understanding of bacteriology. Joseph Lister applied Louis Pasteur's bacteriological research to human infection. Lister used carbolic acid as an antiseptic to spray on wounds, the operating table, and into the air in the operating room. Lister also developed sterile absorbent sutures so that the end of the sutures could be cut short and the wound could be closed tightly. Lister's principles were later used in 1886 to develop a method of asepsis and steam sterilization. Blood transfusions were another rapidly advancing surgical method. After James Blundell performs the first successful human blood transfusion on a patient suffering from postpartum hemorrhage. In 1852, J. Marion Sims, known as the father of gynecology, developed a technique to repair vesicovaginal fistula using silver wire sutures. By 1800, the Roman Catholic Church and organized medicine faced the dilemma of how to resolve cases of obstructive births. American physicians usually practiced destructive operations, like craniotomy, in an attempt to save the lives of the mothers. The Church allowed such operations after the death of the infant. A new technique of surgery, the cesarean operation, offered hope that both patients would survive childbirth. Medical progress and an emerging Catholic belief that the fetus was human prompted Catholic physicians to advocate the new operation and stirred a renewed debate among European theologians on the propriety of craniotomy. In America, the broad Christian tradition promoted by the Catholic Church began to inform medicine on the moral and ethical parameters of surgery. American physicians, for their part, engaged in their own debate on the propriety of the cesarean operation. Overall, many surgical advancements were made during this century, leading into an even more daring era of surgical innovation, the 1900s.
Thank you, Dr. Charles Ennis, for that presentation on surgery in the 19th century. We're now going to shift to look at our final time period, the 20th century, where we're going to hear from Jessie Duncan on her take on innovations that occurred in the 20th century. Howdy, y'all. I'm Jessie, and I'm going to tell you about surgical innovations, new techniques, and procedures done in the 20th century. The first non-direct blood transfusion was performed by Albert Huston March 17, 1914, at the St. John's Hospital in Brussels. This was done by the use of sodium citrate and glucose as anticoagulate. The first hospital-based blood bank was established by Dr. John S. Lunday at Mayo Clinic, 1935. Two years later, investigated quick freezing as a method of prolonging the shelf life of bank blood. Blood transfusions became a pivotal part of surgery during the times of the Spanish Civil War, Frederick Durand Jordan collected, stored, and transfused 9,000 liters of blood. With the availability of non-direct blood transfusions, surgeons were able to expand on their techniques and procedures. One such advance was the implantable pacemaker, with the first clinical operation taking place in 1958. With several research groups working on the same problem, pacemakers were improved from large machines weighing 45 kilograms, powered to a car battery, more manageable, relatively small sizes that were to be implanted in the patient's abdomen. Threading leads up to the heart, attaching them to the myocardium. The largest advantage of the implantation of the pacemaker are no wires entering the skin, which would provide an operating site for infection. In 1960, the first hip replacement was performed. The first step in the hip replacement surgery is to make an incision at the hip and saw off the head of the femur. Next, surgeons would reshape the pelvis. When shaped correctly, the new hip is inserted, drilling a stem into the femur with a ball on the end, secured with screws and a socket fitted into the pelvis. Polymethylmethacrylate is then used to fill empty spaces, cementing them into place. Though the procedure for hip replacement has not changed much over the past 55 years, the materials they are made from have shifted from primary metal to polyethylene. In the case of trauma, many reports of incomplete separations were salvaged. It was not until 1963, though, that the reattachment of a fully severed body part was completed. The amputation was clean enough to allow proper reattachment, which testifies to how far surgical techniques advanced. Possibly the only thing more impressive than a reattachment of a limb would be the transplant of a heart. First clinical heart transplant was performed in the hospital of the University of Mississippi, my home state, in 1964. The heart obtained from a chimpanzee was successfully transplanted to the recipient, a 68-year-old man who lived for 9 months before dying of alternate causes. Several years later, the first human heart transplant was performed, but unfortunately the patient died 18 days later due to pneumonia. Following the transplant of the heart, further steps were taken and heart-lung transplants were attempted. In 1981, the first heart-lung transplant was successfully performed by Dr. Bruce Ritz of Stanford University. Surprisingly, the success rate for heart-lung transplants were reported to be higher than lung transplants alone. Advances in surgery are still occurring today, and I look forward to reading about all of them. I thank y'all for listening. As you've heard today, there have been many trials and tribulations across many time periods that led to today's modern standards of surgery. Every idea, failure, and discovery was vital in forging the path to lead to the perfection of this life-saving practice. I look forward to someday discussing with you the modern surgical advancements of the 21st century. Coming up next week on the History Channel, we will take an in-depth view of the Black Death and the physical, social, and economic effects it had on Europe.